Well, great. It's a real pleasure to be able to join you today and tell you a little bit about what we understand about some of the causes for gastric cancer. And particularly, we'll be talking about some of the genetic causes. So it's a real privilege to have be invited to speak to you today. And just to give you a little bit of background behind who I am and why I'm speaking on this. So I'm a gastroenterologist, and I work at the University of Washington. I also work at the Seattle Cancer Care Alliance, and that's where I have a role as I'm the medical director for the GI Cancer Prevention Program. And in that clinic, we see people at high risk for lots of different types of gastrointestinal cancer, and one of them is gastric cancer. So let me tell you a little bit about what we understand about hereditary or familial gastric cancer. So first of all, this is a little bit of a busy slide, but really what I want you to take away from it is that there are different reasons why we get stomach cancer. And I tend to lump them into either environmental causes, so those are things like what Valerie was just talking about, like Helicobacter pylori, things that we get exposed to during our life. But then there are genetic causes as well. And that's one of the reasons why gastric cancer is so common. It's, as Valerie mentioned, it's the fifth most common cancer worldwide. And sometimes we have genetic predispositions, and that's what's shown over here in these boxes. Sometimes there are environmental factors. And when we look at hereditary cancers, where we have specific genes identified, that's around 5%. So about one out of 20 people have a strong genetic cause for gastric cancer. And so again, so if we look at that just in words, what we can see then is that we think about 10 to 20% of gastric cancers have a very strong genetic component to them. The remainder are predominantly environmental, and it's that Helicobacter pylori, which is really I can't tell you what a shocker that was in the field, because I was kind of working in the area at the time. I was in training, and I tell you, most of us thought Barry Marshall was a crazy man, and we didn't believe what he was saying. And it took quite a bit to convince the community that Helicobacter pylori could actually cause ulcers, and it looks like it's a big cause of gastric cancer. So in fact, there are actually programs going on to eradicate gastric cancer in areas where we see it really common, like in China, and where we can get rid of Helicobacter pylori, we can really dramatically decrease the risk of getting gastric cancer. And I'm going to come back to that, because that's important not only for run-of-the-mill gastric cancer, but also for people who are genetically predisposed to gastric cancer. Now, if we look at some of the more specific genes that have been identified that can cause specific forms of hereditary gastric cancer, there's a bunch of these listed here, and I'm not going to go into the alphabet soup that these are all involved with. I mean, they mean something to people who work in a particular area, but otherwise they're just a gamish of different letters. So there are a variety of different forms of gastric cancer that are genetic that have been identified. And the reason why that's important is that depending on what the gene is that causes the type of gastric cancer leads to very different things that we're going to recommend to prevent gastric cancer. And also it's important in the families to know what the genes are so we can best identify what type of genetic test ought to be done. And so the ones that we're going to talk about predominantly today are going to be this one, hereditary diffuse gastric cancer, another one called Lynch syndrome after Dr. Lynch, who identified it, and then familial gastric cancer. And we really won't touch on some of these other ones because they're a lot less common, but if it is something that does affect you personally, I'd be happy to talk to you more about this after at the end of the day. So let's talk first about familial gastric cancer, because that's the most common form of familial or hereditary gastric cancer. And the way that gets defined is if you have lots of people in your family with gastric cancer. And so there are some formal criteria that are used, and those include if 2 or more people in your family have had gastric cancer, and they're first or second degree relatives, because that shows how genetically connected they are. typically, we see people at a young age where we see a strong genetic factor playing a role. So if we'd be looking for people in the family under the age of 50. And then there are two different flavors of gastric cancer that we see. One type is called an intestinal type, and then the other type is called diffuse type. And we'll get into that in just a little bit. Often, Helicobacter pylori is involved. Now, there haven't been any specific genes that have been identified for this familial form of gastric cancer, but there are some gene variants that probably play a role in increasing the risk for getting gastric cancer. So again, if we think worldwide, it affects about 6% of people, so that's around 1 in 19 people. If you have familial gastric cancer, your risk is probably closer to 1 in 10 to 1 in 15. So it's a slight increased risk, but not a really strong increased risk. So the question is, so what do you do if you have many people in your family with gastric cancer? What can you do to decrease your risk? Well, one is avoid risk factors, and the one that you heard about just from Valerie was Helicobacter pylori. So we can do testing for this. And so if you have people in your family who've had gastric cancer, you should get tested for Helicobacter pylori, either with a stool test or a breath test. And if you have it, you should be treated for it. There are diet seems to also play an important role, and so salty and pickled foods go along with an increase in the risk for getting gastric cancer. If you eat fresh fruits and vegetables, that decreases your risk. So I always avoid people avoiding an Asian-style diet. What's interesting is that out of all the Asian groups, and they're all at increased risk for getting gastric cancer, so Vietnamese, Chinese, Japanese, Koreans, the Koreans have a really high risk. And so I say, whatever they're eating, don't eat it. So that's like kimchi, those sorts of things. Maintaining a normal body weight, and then avoiding tobacco products. But the other thing that you can do that's a medical thing is to get your stomach looked at periodically. And we can look for precancerous features. And that's what I've mentioned here, and they have these funny names, intestinal metaplasia and dysplasia. So what are we looking for when we do that endoscopy? Well, mainly, so for those of you who aren't familiar with it, the way it works is that we have a tube that has a camera on the end of it with a light. And we have you swallow that. We look down in your esophagus and we can inspect your stomach as well as the first part of your small bowel, but it's really the stomach that we're interested in here. And mainly what we're looking for is what you can see right here, the normal pink color over here is what the stomach looks like. This red area, that's gastritis. And if you have gastritis, you're at increased risk for getting stomach cancer. And it can cause the stomach to start developing some precancerous changes. So that's what we're looking for. And endoscopy is used very commonly in Japan and China as a screening test for gastric cancer. And we recommend doing this every few years and looking for these precancerous changes, because what we want to avoid is this here. This is a stomach cancer that we found endoscopically. And so we want to find these precancerous changes and figure out what we can do to monitor them and manage them most effectively. And there are endoscopic surgeries that we can do now that don't require formal surgery, where we can remove any early cancer or at-risk precancerous lesions. So that's familial gastric cancer. So let me tell you about another hereditary gastric cancer where we do have a gene identified. And that's this one called hereditary diffuse gastric cancer. That was actually first discovered, about 1998, and a bunch of Maoris living in New Zealand. And it was discovered these two genes here, called CDH1, and then later another one called CTNNA1. And I apologize for the awful names, but they do mean something to the scientists. And these two genes cause hereditary gastric cancer, and they're the first genes identified to do that. And again, what we're looking for is 2 or more people affected in the family, under the age of 50, or if you have 3 or more people affected, or if you have some of the cancers that we tend to see along with the stomach cancer in this condition, which is breast cancer. If somebody has had both breast cancer and stomach cancer, then we start thinking about this particular syndrome. Now, one thing that's really interesting about this particular type of hereditary gastric cancer is it causes only one flavor or one type of that stomach cancer, and that's the diffuse type. And it's really important in a family, so we ask about this because if you have different types of stomach cancer, you don't have this syndrome. And like same ways, breast cancer, there's different types, and it causes only one type of breast cancer called a lobular breast cancer, and that's an uncommon form of breast cancer. So if a woman were to have both of these, we'd really wonder about this syndrome, and we definitely would want to check for it. So what are the genes that have been identified? Well, even though we have these two genes, still most of the people who have this hereditary diffuse gastric cancer, shown here in brown, we don't know what causes it. So we're still looking. And part of the challenge is there are a lot of genes. There are about 20,000 genes. And so it takes us a while to kind of sort through all of them and figure out which ones might be causing different types of hereditary cancer. But again, we have found this CDH1 gene causes a lot of the hereditary diffuse gastric cancer, and a bunch of other possible genes have been identified, but this one right here, this CTNNA1, that's the other big one that tends to cause this syndrome. So we look for these. If we can find it in the family, that's really powerful, because then what we can do is we can test other people in the family. We can figure out whether you're really at risk. Now, one of the big challenges, though, that I'm going to talk about in a minute is as gene testing has gotten a lot cheaper, now we're identifying lots more people who have this gene mutation, and sometimes we find it accidentally, and people are getting checked for some other reason. And we don't know quite what to do with that. And I'll tell you about the reason why that's a big conundrum for us in just a second. So one of the things I want to point out to you before we get into what we do to take care of people who have hereditary diffuse gastric cancer is show you what I mean by this particular type of gastric cancer. And so it's called a signet ring or gastric or diffuse gastric cancer. And you could say, well, where would signet ring come from? And that refers to the fact that it looks like a signet ring, which for those of you who don't know, this was used in the past basically to put the wax seal on envelopes and seal a letter. And so it had a heavy part to the ring, which is shown here. So if you look over here, what you can see is all this pink stuff is gastric cancer. And if you look, there are like lots of little circles, pink circles with purple dots on the corner that look kind of like that signet ring. Those are the cells that we see in signet ring gastric cancer or diffuse gastric cancer. So we're looking for this. This is the one type of gastric cancer that occurs in this syndrome, and otherwise it accounts for about maybe 1 in 3 gastric cancers. Most of them are this other type called intestinal type, but about 1 in 3 gastric cancers in general are this diffuse or signet ring type. So that's the type we're looking for. The other thing that's true about this diffuse gastric cancer type is what's shown here, and I really want you to focus in on this red circle. Where this cancer forms in the stomach is in the middle of the lining of the stomach. And that's, again, really important for this particular type of gastric cancer because it makes it really hard to do endoscopy and to find it because it starts growing in the middle of the stomach rather than on the inside where the intestinal type grows. So when we put our tube in here, we really can't see it because it's hidden, but it's below the surface. And so the reason why that's a big issue is that if we ask what are we going to do for people who have hereditary diffuse gastric cancer, well, first thing is to come to a high-risk breast cancer clinic and also to come see someone like me in a GI cancer clinic. But then the other thing we recommend is actually taking the stomach out in these people because the risk is so high of getting gastric cancer. We think when people have family members with gastric cancer, their risk is about 8 out of 10. So it's almost a sure thing that you're going to get gastric cancer. And since we can't do surveillance with endoscopy, we recommend taking the stomach out, and that's a big deal. So the challenge then becomes, so now that we're accidentally finding some people who have this gene mutation who don't have family members with stomach cancer, we don't know what to do. And so we're actually enrolling those people in a study called the PROMPT study. So if this applies to any of you, or if you know anyone like this, I'd be happy to help out getting you in connection with the PROMPT study, because we're trying to figure out, well, what is the real risk in people who get found accidentally to have this gene mutation, and then do they need to worry or not? And unfortunately, we just don't know yet. It's early days. So the other thing we recommend, though, is that and people who do have a family history of stomach cancer and they refuse to have their stomachs removed, and that's not uncommon in my experience, we can do surveillance with endoscopy and at least try to detect the early gastric cancers. And occasionally that'll work, but we miss a lot of early cancers, and I warn people about doing this strategy. And sometimes it just takes a little bit of a kind of warming up to the idea that maybe this really, having your stomach removed really is the best option, but you're not willing to do it just right away. So we do recommend then take the stomach out. Preferably, we can do endoscopic surveillance. And then the other thing is, because there is that increase of breast cancer, we recommend annual breast MRIs after the age of 30 in women who have this. And then there may be an increased risk for colon cancer, so we recommend colonoscopy starting about 10 years younger than we recommend in the average person, and doing it every 5 years. So that's hereditary diffuse gastric cancer. The last syndrome that I want to talk about is Lynch syndrome, again named after Dr. Lynch. So not because you need to get hung because you have this, okay? So sometimes when I tell people about this syndrome, their eyes open up really wide and like, what do you mean Lynch syndrome? So Dr. Lynch discovered this, and it's caused by genes that are in this family of genes called the mismatch repair genes. So they're basically a DNA repair family of proteins that basically proofread your genetic code and make sure that it's that it all looks like it's spelled correctly. So there are a variety of these different genes. There are 2 of them out of the different ones that can cause Lynch syndrome that are most highly associated with gastric cancer risk, and one's called this MLH1, and the other one's MSH2. Now what's interesting is the risk for getting gastric cancer if you have Lynch syndrome is really the highest in places where we see a lot of gastric cancer. So again, China, Korea, Japan, and less so in the U.S. In fact, actually, if you go back 100 years ago, when the first families with Lynch syndrome were described, almost everybody was getting gastric cancer. And now we don't see it that often. But back 100 years ago, people with Lynch syndrome weren't getting much colon cancer, and that's the most common cancer that we see in Lynch syndrome. In fact, now, if you have Lynch syndrome, your chance of getting colon cancer is about 7 out of 10. And 100 years ago, that wasn't true. And you could say, well, how could that be? Because I can tell you the genes haven't changed that much, because that's only a few generations. And so it's something about the environment and the genes and the way they're interacting that seems to change that risk. So even though we look for gastric cancer and Lynch syndrome, we don't worry about as much in somebody who's from the U.S. as we do in somebody who's from Korea. And so we think one of those important environmental factors is, again, that H. pylori that Valerie mentioned. And we think that was playing a big role in the U.S. 100 years ago, and it's become less common in the U.S. now, and we think that's the reason why gastric cancer is less common in Lynch syndrome patients now. So there are a variety of different cancers that people get when they have Lynch syndrome. And the ones that I really want you to notice here are gastric cancer is a more common one. Again, more common in areas where gastric cancer is common in general. But we also see urinary tract cancer and endometrial cancer. And what isn't shown here is colon cancer, because that one's the most common one. So these are All these cancers, though, we do screening for. And if you get seen in a clinic like the one I run, we come up with a personalized, optimal cancer prevention program clinic that accounts for all these different types of cancers and what we can do to help prevent them. So what do we do for gastric cancer and Lynch syndrome? Well, again, we recommend going back to that, our old friend, the endoscopy. So we recommend starting that around age 35 to 50 and then doing it every few years and looking for some of those precancerous changes. And then we also recommend getting checked for Helicobacter pylori, and then just following prudent lifestyle and diet recommendations, which are good in general for keeping you healthy and also help keep the gastric cancer away. So the last one I'll mention is one that's called gastric. It's GAPS, gastric adenocarcinoma and proximal pulposus syndrome. And in this one, what we tend to see is these are pictures of the pathology of the polyps that we see in this syndrome, and they look like this. You can see they kind of look like little mushrooms. And then the gastric cancer that occurs in this syndrome. And this is seen when people have lots of polyps in their stomach. And if they have that and they have other people in their family getting gastric cancer, we worry about this particular type of syndrome. Unfortunately, we don't have a gene test for this, so the only way we can figure it out is by doing endoscopy. But if you do have it, unfortunately, you're probably going to have your stomach taken out because the risk for getting gastric cancer is quite high. And because we can't take out all the polyps, which are the precancerous changes in the stomach, it ends up being a situation where you need to have your stomach removed. So then, just to sum up what we talked about, so there are environmental and there are hereditary causes of gastric cancer. I've shown you that there are many types that are identified. The reason why it's important to know what type you have is not only because if we can identify the gene of the family, we can figure out specifically who in the family is at risk for getting gastric cancer and who isn't, rather than just kind of trying to make our best guess. And then also we can develop an optimal personalized cancer prevention program depending on what type of hereditary gastric cancer you have. And then that cancer prevention program which will lead to cancer prevention or effective treatment of the gastric cancer if it does occur, includes endoscopic surveillance, avoidance of risk factors, and then again, checking for H. pylori and treating for it if you've got it. So I'd just like to sum up then with a few resources that are available for people in the Northwest area. One is that gastrointestinal cancer prevention program that I mentioned, and that's at the Seattle Cancer Care Alliance. But I also want to mention at the University of Washington Medical Center, we have a gastroenterologist, Yutaka Tomizawa, who is specialized in doing the most sophisticated forms of endoscopic surgery for removing early gastric cancers. It's called endosubmucosal dissection, and there are only 2 or 3 centers in the U.S. that can do this. And so he's a great resource if this is something that you do need. And it would avoid having your stomach taken out. And then the last thing, if you are in that situation where you do need to have your stomach taken out, we have some great surgeons, and I think you heard from Dr. Oschleiger earlier this morning at the Center for Esophageal and Gastric Surgery at the University of Washington. And Dr. Oschleiger has done a large number of prophylactic stomach removals on family members that I manage who have that hereditary diffuse gastric cancer. So he's quite experienced at it. And so with that, I'll just leave it. I'll finish with that and be happy to take any questions. So thanks for your attention.